1 in 3 people on Ozempic can't even leave their house right now because they're terrified of being more than 30 seconds from a freaking bathroom. 57% are dealing with abdominal pain so severe that they're doubling over every meal. Some haven't even had a bowel movement in over a week. And the scariest of all, there are 5 rare complications that could send you straight to the ER. But here's the deal, you won't have to suffer like this after I teach you how to approach your GLP-1 dosing schedule. If you're new to my channel here, hi, I'm Dr. Jones DC, and I coach thousands of patients on GLP-1 meds every single day. And this passion of mine comes because I've lost over 100 pounds myself and struggled for dang near a decade to figure out how to maintain my weight loss. And now I help individuals working with my practitioners do the same. In part 1 of this series, I revealed the side effects that destroy your quality of life. The zombie mode, the motivation crashers, the hair loss, the muscle wasting. If you haven't watched that yet, then I'll be sure to link to that video in the description below. But today, in part 2, we're diving into something even more urgent, the digestive disasters that makes people quit these medications, plus the 5 warning signs that mean you need to stop your medications immediately. Here's what nobody's talking about. These bathroom problems, they get 10 times worse with aggressive dosing. The cookie cutter protocols that your doctors follow, they're setting you up for misery. But when you understand what's really happening in your gut and in your body, really, you can take full control. Let's start with the one that affects over half of you, abdominal pain. And I'm not just talking about a little discomfort here. 57.6% of users experience this. That's more than half of you clutching your stomach right now. But not all pain is the same, and it's important that you understand the difference. Location matters tremendously. Let me show you. Cramping and pain here usually means gas or constipation, often worse after eating. Now, this one's particular. Sharp pain below, so here's your right rib cage, kind of halfway through, right below that on the right side, that could mean gallbladder. And if this pain happens, especially after fatty meals, it feels like a knife, definitely something that you might want to go talk to your doctor about. Now, acid reflux is going to be pain that starts off generally in the center and works its way and travels up all the way up the esophagus. That is acid reflux, and we'll talk about how you can handle that later. And then finally, pancreatitis, the worst of all. This is going to be pain that might start centrally, but if it wraps around the side and maybe even causes low back pain, and it's bad, you definitely want to go see ER. You don't want to mess around with this. So the red flags for pancreatitis: pain starts centrally, wraps around like a bell, worse after eating, comes with nausea and vomiting. You might lean forward for relief. If you feel like you have that wraparound pain, especially with a fever, go to ER. Don't wait. You don't want to mess around with pancreatitis. Okay, for common discomfort, digestive enzymes with every single meal. Your stomach is struggling to break down the food. Get yourself a good broad spectrum digestive enzyme product. Spread your meals out. Instead of eating massive meals, smaller portions can help as well. Your stomach capacity is reduced because you're eating much less food overall. Think 4 to 5 smaller meals within that fasting window. Ideally, you're doing some intermittent fasting. No water before you eat and after. This allows your digestive juices to get unraveled and start working. And avoid certain triggers like carbonation, spicy foods. Particularly trans fat and fried foods can be notorious for causing individual stomach pains. Remember, lower doses significantly reduce all of these risks. Another reason why this approach makes so much sense. All right, we have to have poo in our life. No poo is a problem. 30.4% of users can't go. And I mean really can't go. We're talking beyond a freaking week for some people, and that's a problem. By the way, if you haven't pooed for over a week, go to the ER and get that checked out because that can be a potentially life-threatening situation. This isn't just about being uncomfortable. This is toxic waste that's sitting in your system. Here's what happens. So GLP-1s slow down your entire digestive system. Food moves through like freaking molasses. And add in dehydration and low fiber. This is a recipe for disaster. Couple quick fixes. If you're stuck, and literally stuck, magnesium citrate 400 to 800 milligrams at bedtime. Start low and increase as needed. You don't want to mess around with magnesium citrate because this will open up the pipes, if you know what I mean. Even 10-minute walks can help. Walk around your block. Your intestines need motion. Fiber, 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 but timing matters. Not with meals, between your meals if you're constipated. Basic psyllium husk can work great in water. Mix it up as well. Also, you can use my favorite fiber product is Life Fiber from Unicity. Another great solution is the proper position when you're trying to poo. Feet elevated on a stool helps. The squatty potty is amazing. Hydration is crucial, about half of your body weight in ounces of water every single day. Diarrhea, 32.7% have the opposite problem. You can't leave the house. Life is freaking disrupted. Now, the thing about massive diarrhea, my biggest concern is electrolyte imbalances. You are losing minerals like crazy, not just water, sodium, potassium, magnesium. Make sure you replenish those electrolytes relative to how much diarrhea you're getting. Now, doctors will tell you to follow the BRAT diet, bananas, rice, apples, and toast. But here's the problem. All that high carb food will spike your insulin like crazy, and that's the last thing you need when you're trying to improve your metabolic health. A much better approach, binding foods that don't wreck your blood sugar. Bone broth that we showed you earlier with some added salt to help replace electrolytes. Plain cooked chicken that's easy to digest protein. Psyllium husk in water bulks the stool naturally. And even activated charcoal can serve to help bind up those toxins. Get yourself a good probiotic, about 50 billion CFU minimum. That's the amount of good bacteria in each dose, and that'll help you rebuild your gut. Look for ones that have multiple strains. A little timing trick that can help, take your shot at night. Sleep throughout the worst of your symptoms. A lot of people report that this makes a significant difference. And when in a pinch, if nothing else is working, Imodium for emergencies only. Just don't become dependent upon that. Nausea and vomiting. 23.4% deal with this. Some of you can't even get the water down. Jessica was vomiting after every single meal. She lost 15 pounds in 2 weeks, but it wasn't fat. It was dehydration and muscle. She also felt super weak. She could barely function. So some immediate relief to help. Ginger, about 1,000 milligram capsules or fresh tea, proven anti-nausea effect. Works as well as some prescription meds for some people. P6 acupressure point. Let me show you exactly. So about 3 fingers from the base of the wrist, right there on the side of your index finger, you're gonna see some tendons right there. Find the middle of those tendons, push it and hold it there for about 30 seconds. You can even do some circular motions too as well. Now here's a bizarre trick that people swear by. Sniffing alcohol prep pads. I know it sounds a little wonky here, but give it a whirl. Doesn't smell too great, but at the end of the day, if I was nauseous, that might actually help. Let me know, has that helped for you? I'm really curious. I've had a lot of patients actually tell me that this worked wonders and it was very rapid. If all else fails, I have some medications for you, over the counter, Dramamine, and if that doesn't work, Zofran does require a prescription, but that is very powerful. Don't be a hero if you can't keep your water down and you need help. Get the medications, get the support. Now here's where it gets interesting. You've seen the side effects, you know the solutions, but you're probably wondering, why does this happen? The answer will change how you think about your medication forever. The truth about your side effects. All right, you've seen the carnage, 10 side effects that are making your life miserable. But here's what clicked for me after seeing thousands of patients every single day dealing with these side effects, getting worse with dose escalation. Your body has GLP-1 system and has receptors everywhere. The brain, motivation and appetite, stomach, digestion and nausea, intestines, motility, which means movement, and diarrhea, the pancreas, insulin and inflammation. Throughout your tissues, when you take GLP-1 medications, you are not just affecting one area, you are affecting and flooding your entire system. Standard dosing protocols say double your dose every single month. We talked about that. You guys saw how disastrous this is. That causes your receptors to be screaming. Stop it already. Think about it like this. Imagine your favorite song, play it at normal volume, beautiful, but now crank it up to maximum, it's distorted, it's painful, it's overwhelming. That's what aggressive dosing does to your receptors. Remember, your doctors are stuck and glued on this because that's what the study shows. That's what got these drugs approved. They needed fast results, and most likely you're working with a telemed company where you have one doctor freaking signing off on thousands of patients. You're not getting individualized care, you're getting cookie cutter templates, and you're paying the price. Pharmaceutical companies wanted to show maximum weight loss in the minimum time, and so that's why they pushed higher doses and side effects were considered acceptable. But you're not a study, you're a person that's trying to live the best life that you possibly can. The low dosing logic is clear. What if instead of overwhelming your system, you gently activated it? Start low and stay low, only increase when absolutely necessary. Your receptors will stay sensitive. While we've covered the common side effects, there are rare complications that you absolutely must recognize. The next 5 are different. They're not dose-dependent annoyances. They're medical emergencies, and knowing the warning signs could literally save your life. Now, they're rare. We're talking less than 1% for most of you, but you need to know these warning signs. Number 1, blindness. Non-arthritic ischemic optic neuropathy. Whew, that's a mouthful. Let me break this down because the media went freaking crazy about this one. NAION is when blood flow to your eye nerve gets cut off. It's like a stroke, but in your eyeball. Here's what's the reality. It's bullshit. You have to understand this is extremely rare and it's more likely to affect diabetics with a history of retinopathy. Impacts one eye and happens in people with those existing risk factors like we said, diabetic retinopathy. Here's some warning signs to think with if you have sudden vision loss in a single eye, like kind of the curtains dropping, usually painless, happens within hours. If this happens to you, then yes, stop the medication and see an eye doctor immediately. But don't let the fear-mongering headlines keep you from a medication that quite literally will save your life. The risk is real, but it's tiny. And guess what? Lower doses will actually reduce this risk entirely. Number 2, gastroparesis, aka stomach paralysis. Your stomach literally stops moving food throughout, it just sits there. Warning signs to think with: severe bloating after tiny amounts of food. The food is literally sitting in your stomach for hours and hours. Imagine you eat this food and it just sits there. It will cause pain and discomfort. Vomiting undigested food from yesterday, feeling full for days. This can become permanent if not caught early. Lower doses significantly reduce this risk, just saying. Pancreatitis. We touched on this earlier. 0.1 to 0.3 risk, very minimal. Your pancreas gets inflamed and swollen. Warning signs again, that severe abdominal pain that wraps around the back, low back pain like a belt, worse after eating, comes with vomiting and fever sometimes. Don't mess around with this, go to the ER. This is not something that you want to play around with because it can become fatal if untreated very quickly. Gallbladder problems, still rare, but worth knowing. Warning signs: sharp pain under the right ribs that we talked about earlier, especially after fatty meals, pain that might shoot to the right shoulder, nausea with the pain, rapid weight loss that creates gallstones, another reason that low doses are so effective. Suicidal thoughts, very rare. Studies show no significant increase when properly analyzed, but monitor yourself. Warning signs: new or worsening depression, thoughts of self-harm, personality changes, hopelessness. If this happens, tell somebody immediately, stop the medication, get the help that you need. Finally, thyroid cancer. This one's very controversial because the black box warning still exists, but there's been massive data and even newer studies that have recently came out that almost prove this is not possible. We can say it doesn't cause. We can't quite say that, so the box labels are there, but rest assured that from my understanding and many practitioners, the risk is essentially non-existent at this point. Warning signs to still look out for: lump in your neck, hoarse voice, trouble swallowing, swollen lymph nodes. If you have a family history of thyroid medullary cancers, then you should still play it safe and not take the GLP-1s, period. The key message is clear. These 5 complications are rare. I'm talking lottery odds for most of them, but here's what's important. Lower doses appear to reduce the risk across the board. When you're not overwhelming your system, complications drop dramatically. So now you know the side effects, you know the solutions, you know the risks. What's your next move? All right, you just learned more about GLP-1 side effects than most doctors know. Now what? Step number 1, assess your current situation. Pull out your phone, write this down. Your current dose, which side effects you're experiencing, how fast you're losing weight, and if you're losing more than 0.75% of your body weight per week, you're going too fast, and we talked about why that is. If you have more than 3 side effects, your dose is likely too high. Step number 2, have that conversation. Talk to your prescriber about staying at your current dose for longer, or even maybe reducing it. Show them this video. If you need, the science is clear. Lower doses work. And if they insist on aggressive increases, then it might be time for a second opinion. Step number 3, implement the solutions now. Pick just 3. I know we covered a lot, and it could be overwhelming, but pick 3 solutions from today. Just 3, start here. Maybe it's protein for your first meal, 30 to 40 grams, magnesium at night, 400 milligrams, rotating those injection sites properly. Small changes compound over time. Track everything: side effects, energy, weight loss, but also measurements and how you feel. The scale isn't the only metric. If you're looking for some personalized guidance, look, I get it. I know that this is a lot to navigate, especially alone. If you're looking to do something that goes against the grain, which is what we're teaching you right now, and you're ready for a comprehensive approach, one that sets you up for success long-term, then book a free discovery call with my experts. I'll drop a link in the description. It's a simple process. Get yourself booked, figure out exactly if this is the right plan for you, and we're gonna be here for you to help you, whether it's now or later, because you deserve to lose weight without suffering. I wanna share my final thoughts. Remember, side effects aren't badges of honor. They're not part of the process. They're your body asking for help. The goal isn't just weight loss, it's sustainable transformation while feeling amazing. You've got the knowledge, now use it. Take control of your journey. Your future self will thank you. If you guys enjoyed this video and you haven't checked out the recent video that I did in Costco, check it out right there. I break down exactly some of these great items that you can purchase from your local Costco at a great discount too as well. We'll see you later.